You're here because you want to get informed, fast, and efficiently.
Exactly.
Think of this as your personal shortcut, your streamlined guide to understanding nursing in the GCC countries. That's the Gulf Cooperation Council.
And that really important exam, the Prometric.
The Prometric, yes. We're going deep today on what it actually means to be a nurse over there.
And we'll be, demystifying that exam. We're drawing from a document titled GCC Amkarapokanpan Kanapombanauta Prometric Ahob.pdf.
Right. So our mission really is to pull out the absolute must-know info, give you clarity, maybe a few surprises.
Without getting bogged down in unnecessary details.
Exactly. Okay, so let's start with the basics. What does nursing actually look like in the GCC today? Is it changing?
Oh, absolutely. What's really noticeable is how the profession has evolved.
Yeah.
It's become much more significant.
It's more central to healthcare.
Definitely. Nurses are playing a pivotal role now, and not just in one place. They're across loads of different settings.
So we're not just talking hospitals then. The source mentioned a wider range.
Precisely. Yes. Hospitals, of course, but also outpatient clinics, community health centers, even schools.
Schools, too. Interesting.
And their responsibilities are pretty extensive. And they seem to be, expanding all the time to meet the region's needs.
Okay, so beyond, the core patient care, what specific tasks are typical?
Well, the direct patient care is fundamental, naturally. Administering meds, wound care, monitoring patients closely.
The essentials.
The essentials, yes. But it goes quite a bit further.
Our info also highlighted things like health education, counseling. That sounds like a big focus on prevention.
It really is. Preventative strategies, patient education, they're becoming more and more critical for managing public health effectively.
Right.
And nurses are also key parts of surgical teams and in critical care. Think ICU, ER, those high acuity settings.
High acuity, meaning complex cases, close monitoring.
Exactly, where patients need really intensive support. And another big area is managing chronic conditions.
Like diabetes, hypertension, things like that.
You got it. The document specifically calls those out. There's a huge need for skilled nurses there. But what's also quite interesting is the move towards leadership roles.
Leadership. For nurses, how so?
Yeah, we're seeing nurses step up, becoming unit managers, running the day-to-day operations, or even nurse educators.
Training the next generation.
Exactly, shaping future skills. And if you look at the big picture, all the healthcare advancements happening, it makes sense why there's such high demand for advanced practitioners, specialists.
Especially in those critical areas you mentioned, ICU, ER, oncology.
Precisely. There's a real need for that specialized expertise.
Okay, this paints a picture of a really dynamic field with, real room to grow. So if a qualified nurse is thinking about moving to the GCC, what are the first hurdles? Licensing, qualifications?
Good question. That's obviously crucial. The sources lay out a few key things. First, you absolutely need a recognized nursing degree or diploma. That's non-negotiable.
Takes sense.
Second, a valid license from your home country is essential. You have to be in good standing there.
Right.
And third, the big one, passing the Prometric exam. It's mandatory. No way around it.
The Prometric. Okay. Seems like the main gatekeeper. How does someone actually start that process? How do you apply?
You apply directly to the health authority of the specific GCC country you want to work in. So say the DHA in Dubai or MOH in Saudi Arabia.
So it's country by country, not one single GCC system.
Correct. Each country has its own specific procedures, its own requirements. You need to check with the one you're interested in.
And what do they typically ask for when you apply for that Prometric exam? What documents, what kind of experience?
Usually you'll need proof of your nursing qualifications, your degree, diploma certificates, transcripts maybe, properly verified.
Okay.
And yes, nursing experience is almost always required. Generally, it's around 2 to 3 years.
2 to 3 years minimum.
Typically, yes, but it can vary. Depends on the country, maybe the specific job. And something else to keep in mind. English proficiency. Some countries might require proof, like an IELTS or TOEFL score. Not all, but some do.
Right. Worth checking that too. Okay, so you've got your documents, your experience, you've applied. Now you face the Prometric exam itself. What's it actually like?
It's a computer-based test designed to check your knowledge across, the core nursing subjects. The fundamentals for safe practice.
Like what? What are the key areas they test?
The main ones mentioned are medical surgical nursing. That's a big chunk, obviously.
Big foundation.
Right. Then pediatric nursing, maternity, and child health.
Governing the lifespan.
Exactly. Pharmacology is critical understanding medications and infection control and patient safety. Huge emphasis on those.
It sounds pretty thorough. MedSurg, PEDS, maternity, drugs, safety, covers a lot.
It does. For example, within MedSurg, they might test on, say, advanced wound care or managing complex illnesses, reflecting what's needed there.
So what's the ultimate point? What are they really trying to figure out with this exam?
Well, it's about evaluating your clinical judgment. Can you make sound decisions in different patient situations?
Okay.
It also looks hard at critical thinking, how you analyze information, put things together, solve problems. Basically, do you understand and can you apply best practices in nursing?
So it's not just recalling facts, it's applying knowledge.
Precisely. Application is key.
Okay, so let's say you pass. You nail the Prometric. What happens next? Do you get a job offer straight away?
Not quite that fast.
Yeah.
Passing means you've hit that benchmark. You're now eligible to apply for a nursing license in that country.
Eligibility. It's a crucial step, but not the final one.
Exactly. It unlocks the door to actually getting licensed to practice legally there.
And is that pass result good forever, or is there a time limit?
There's a time limit.
Yeah.
Sources say the score is typically valid for about 2 years.
2 years, okay.
Yeah, so once you pass, you generally have that window, roughly 2 years,
Yeah.
to get your full nursing license application sorted.
Got it. Okay, now let's shift gears. Let's talk about the payoff. Why are nurses increasingly drawn to the GCC? What are the big advantages?
Well, the information points to several really strong benefits. First, there's real potential for career growth, opportunities for leadership training, clear paths for promotion.
So you're not just stuck in one role forever.
Not at all. That upward mobility is a major factor.
What else makes it attractive? Money, benefits.
Definitely.
Yeah.
Competitive salaries and often quite comprehensive benefits packages are a big draw. They need skilled people, so they make it attractive.
Makes sense.
And there are also often chances for continuous education, getting specialized certifications, ways to keep learning and refining your skills.
So career growth, good compensation, ongoing learning, anything else?
Yes, the experience itself. Working in diverse multicultural teams, that's a huge plus for many people, both professionally and personally.
A different cultural environment.
And if you think about the bigger picture, things like Expo 2030, the Vision 2030 plans across the region.
All those big development projects.
Exactly. They're driving massive investment in healthcare, upgrading facilities, expanding services, which all fuels the demand for more qualified nurses.
So it all connects. The growth, the opportunities, the demand. So wrapping this all up, what's the absolute core message for a nurse thinking about this path?
The bottom line is this. If you want to build a really successful career in the GCC's healthcare sector, which is, growing and changing fast, then passing that Prometric exam. It's absolutely essential. It's the key.
It really sounds like it unlocks a whole world of possibilities. Mastering that exam, it really makes you think, doesn't it? About the potential, the growth. What new levels could a career reach in such a dynamic part of the world once you clear that hurdle?